On the latest episode of the Excerpt, the focus turned to a turbulent week in Washington as Health Secretary Robert F. Kennedy Jr. faced sharp criticism during a contentious Senate Finance Committee hearing. Senators pressed him on accusations of politicizing vaccine policy, cutting staff and funding at the CDC, and firing Director Susan Monarez, a move that triggered multiple resignations. His leadership has rattled the scientific community, with many warning that trust in the nation's public health institutions is eroding. During the hearing, Senator Barrasso pointed to the life-saving impact of vaccines worldwide and accused Kennedy of undermining public trust, citing recent measles outbreaks and policy rollbacks. The shift away from recommending vaccines for nearly all Americans toward only older adults or those with pre-existing conditions has sparked confusion. Pharmacies and insurers are already questioning coverage, raising concerns about access to vital care. The fallout deepened after Monarez's ouster. She alleged Kennedy pressured her to run guidance through an advisory panel stacked with anti-vaccine activists, a claim that prompted an op-ed signed by 9 former CDC directors and a public letter from more than 1,000 employees calling for Kennedy's resignation. Meanwhile, states are reacting on their own. California, Oregon, and Washington announced an alliance to share reliable vaccine guidance, while Florida moved in the opposite direction, denouncing mandates altogether. The political undertones extend into the Make America Healthy Again movement, which has largely backed Kennedy. His early actions banning food dyes and restricting sugary drinks won praise, especially among parents, though supporters now express disappointment over his silence on pesticide regulation. His stance on vaccines, however, has divided even his base. President Trump also weighed in, questioning COVID vaccine efficacy despite championing Project Warp Speed. Analysts suggest he is attempting to distance himself from Kennedy while appeasing both vaccine skeptics and mainstream supporters. Kennedy further fueled controversy by rescinding $500 million in funding for mRNA vaccine development, citing safety concerns raised by his allies. Critics noted the contradiction with his praise of Trump's vaccine program, a tension highlighted repeatedly at the Senate hearing. Speculation now swirls around declining confidence in his leadership at HHS, with delays in releasing the next MAHA health report and silence on promised autism research fueling unease. While Kennedy has signaled a pivot toward tackling chronic diseases like obesity and diabetes, arguing the CDC has neglected prevention, questions remain about whether his vision will restore or erode public trust. The episode closed with reflections on how a cornerstone of American public health, founded in 1946, now faces one of its most uncertain chapters.